Are you looking for a career change? In this video, I will share with you information I provided during an interview on a nursing career alternative. And stay tuned to the end and get a first glimpse of my new promo for our free 5 steps to become a certified marketable medical coder email course. I'm Clarice Warner, the girl with the pearls, the founder and education director of the Professional Reimbursement Network, LLC, where coding education is key, providing you with information, strategies, and tools to become a certified marketable medical coder. A couple of months ago, I was asked to be interviewed regarding medical coding as a nursing career alternative. This was my first interview, and it was so much fun. Here are the highlights of the interview.
Welcome in. This is Christy Hendricks with Change of Shift, and my guest today is Clarice Warner. Clarice has been helping people successfully achieve their goals of medical coding certification for over 15 years. Her education in health information management and her experience as a coder, auditor, and compliance officer gives her a broad base from which to approach any topic. Clarice is a long-standing member of both the American Health Information Management Association and the American Academy of Professional Coders. She is also the girl with the pearls who enjoys motivating and inspiring people to achieve their goals. All right, so I want to welcome in Clarice Warner, the girl with the pearls.
Welcome, Clarice. You, Christy. Hi.
I love that, and I can see that you have your pearls on right now.
Yes, ma'am.
Can't go anywhere without them. Okay, so Clarice, typically I interview nurses, and you're actually the first non-nurse that I'm interviewing. You're so ideally suited to talk to nurses about coding. Our viewers are nurses that they, for whatever reason, they're looking at leaving nursing, probably leaving clinical nursing, but wondering what else can they do with a nursing degree. Some of them leave because they're burnt out of the clinical setting. Some may leave because they have to because of a physical injury or an illness. But why would nurses make good coders?
Great question. Nurses would make excellent coders because of the clinical background that they have and that they bring to the table. So while the education and training portion of becoming, in my world, a certified marketable medical coder involves understanding and knowing medical terminology, understanding and knowing anatomy, nurses bring that additional pathophysiology. They bring that additional disease process component. They bring all those additional components that they've learned through their nursing career and experience that they've had into that process. So when they're coding, say they're coding for a surgery or a particular surgery, they understand the processes, what types of things that could potentially go wrong, what types of things could potentially go right as it relates to that surgery, particularly if they have specialized in that area. They understand any pain thresholds. They understand, because in my experience, and I have nurses who are friends, it's really the nurse who actually runs the world. The nurse actually.
Yeah, we don't always admit it, but yeah, that's what we're thinking. Yeah.
It has been my experience. The nurse usually teaches and trains, documents, and provides the information for the doctor to then give their clinical assessment. But really, it's the nurse who is the nuts and bolts and the glue that holds that whole thing together. So your nursing experience and clinical background would be helpful for the coding professional, because you can actually see the bigger picture and you can see it clinically versus here's a diagnosis or here's a service or a surgery that is being performed. And yet we can take that information and apply a code to it and making sure it's the appropriate code based on the guidelines. But then you can see the bigger picture, especially with ICD-10, where, things are now more specific and, based on, lab results or based on other information, you would be the person who could query the physician and know right off the bat, well, wait a minute, they also are experiencing these types of symptoms, or they're also having these types of disease process in conjunction with this. So maybe we need to ask the physician, like you would normally do in your nursing documentation. Maybe we need to query the physician to say, okay, I've identified that their labs are this or their labs are that. Would you consider this being another diagnosis that the patient may have? And so bringing that type of expertise to the table would make nursing folks excellent coders.
Nursing folks. Okay, I like that. If a nurse wanted to be a coder, so a nurse has already gone through a bachelor's or maybe a master's, what additional education would he or she need to undertake before being able to actually get that first job as a coder?
No additional formal education that they need. They just need to understand and learn the skill of coding.
Because they don't teach us coding. We have familiarity with ICD
with some codes. Right.
But as far as actually doing the coding, that's like what you teach, is that process. Okay. So somebody finishes your course and they're feeling much more confident in knowing the skills that they need to be a coder. And they go sit for those coding exams.
Correct.
Put themselves out. What are the first 5 steps that a nurse would take if she wants to be a coder? What would you recommend that she do? Those first 5 things that she does.
She would need to get into a coding program, because remember, coding is a skill and you need to know how to actually perform that skill. And so being in a coding program, you would hopefully a good coding program such as mine, you would be taught not only the actual skill of here's the diagnosis, how do I assign a code to it, but making sure you understand why you are assigning a code to it, making sure you understand the reimbursement implications related to it, making sure you understand, like I gave that little brief history about, the statistical analysis and the data that is required from that. Making sure you understand compliance and ethics. That's very, very important. Understanding, and this is where, because I've taught physicians to be certified coders, and I've also taught nurses to be certified coders. So while having that clinical background is a blessing, sometimes it can be a curse, because you want to, at some point, diagnose the patient that you're coding for. And so while it's beautiful to have that knowledge, sometimes you have to pull away and say, well, this is not my patient and I'm not diagnosing. Let me code what someone else has provided the clinical assessment for. And so that's where sometimes we run into, because they were like, well, wait a minute, I see this other thing going on here. Why are we not coding that? Because they didn't mention that in their documentation. And the documentation is basically what you have in order to code. And so if you want them to add that, then that's when you would have those additional conversations. From there, I would suggest certification, because again, that's where you show them that, you know what you know your stuff. Most places are looking for certified coders, and there is a high demand, but the supply is rather low. And so that's why it's one of those careers that it has just boomed. And it is continuing to boom. And if you look out about the job outlook and the job projection, medical coding is one of those that is projected to continuously increase through, I want to say like 2020, 2022.
Once you sit for the exam and you pass the exam, then are you not then certified?
You are certified once you pass that exam.
Okay.
Once you take the certification exam, one way to maintain that credential is that you have to have CEUs. Every 2 years is when we report our CEUs. And you can get those in a multitude of ways. You can get them through attending national conferences. Sometimes that's out of reach, unless your employer is actually sending you there to get those, and that's great if they do. You also have local chapters So there is a chapter in virtually every city around the country that you can plug into, and they have monthly or bi-monthly meetings, and you can sit into those meetings and get your certificate or your CEUs. The organization also puts out a monthly publication, and that monthly publication really just gives you updates and hot topics and trends and whatever is going on in the business of healthcare. And they also have quizzes that you can take. And so you can take all of those quizzes, which would help you get that CEU requirement met for that every 2-year period.
Okay, all right, and that makes perfect sense to nurses, because we renew our license, we get our CEUs, and we renew our nursing license. Okay, well, you know what? This has been just an amazing interview. I've learned so much. It makes me want to go be a coder, actually. So now, tell us once again tell us your website again and how people can get in touch with you, and a little bit about how they can enroll in your course.
Sure. So again, I'm with the Professional Reimbursement Network, LLC, where coding education is key. And my website is Ohio, OHIOP as in Paul, or professional, RN.com. So it's OhioPRN.com is the website. This is where we provide the information related to our services. Off to the side, you see our classes. We currently have a free course actually that talks about the 5 steps to become a certified marketable medical coder. Again, that provides you similar to some of the information that we discussed today on what those steps are to get to coding certification. Yep, click here to learn how to become a certified marketable.
Oh, okay, right. You mean the part that's right in front of my face?
Yep, so click on that. This is your free course for the 5 steps to become a certified marketable medical coder. There's a little promo video there where I, walk you through what you'll see. It's actually an email course, so I'll send you 5 steps over the course of 7 days on what you need to do in order to become that certified marketable medical coder.
Clarice, thank you so much for joining us. It's just been a pleasure seeing you, and I think this is a really valuable resource and a real, just an authentic alternative nursing career. Very viable for a nurse, and it's really a logical step for a nurse that maybe just doesn't want to do clinical nursing anymore, or is looking for an option where she can practice from home. So I just want to thank you so much for educating us today, and I wish you continued success in your course.
Thank you. Well, thank you for having me. Thank you for reaching out and say, hey, you have something that I need to know about. And so thank you. I appreciate that.
All right. So once again, this is Christy Hendricks with Change of Shift. I hope you enjoyed this interview. I know I did. And again, just to your continued success. All right. Bye-bye.
So what do you think? Was this informative? As always, if you have found value in this information, please like and comment on our video. We are happy to stay connected with you, and ask if that is something that interests you, feel free to subscribe to our channel. I'll place a link to Christy Hendricks' Change of Shift website in the description box. Now stay tuned to our promo premiere. Are you interested in medical coding, but not sure where to start, and scared of wasting time and resources? Let me help you with the right steps to become a certified marketable medical coder. Learn more at bit.ly/5stepscoder. I'm Clarice Warner, the girl with the pearls, the founder and education director of the Professional Reimbursement Network, LLC, where coding education is key, providing you with information, strategies, and tools to become a certified marketable medical coder, reminding you to be safe, be kind, and don't wish for it, work for it. Until next time, take care.